Hello, guess who? It's Michelle, and I am going to do a live with Courtney unrehearsed, and she is unrehearsed. Um, why? Um, it says she's unable to join. Hold on, let me ask her. Let me invite her, and we'll be able to have this conversation because I know a lot of people. Hey, everyone. Thanks so much for joining. I'm really excited to have this conversation because I know a lot of you, men and women, are parents. You have a spouse. Maybe you have a boyfriend, girlfriend, significant other, children, and you also have TN. So I'm excited to have this conversation and share that side of what it's like. So I'm just waiting for Courtney to accept my invite. And let me just make sure that she does not need help. Let me make sure. I sent her an invite. Hopefully her account is not private. If that's the case, that's the problem. Okay, let's see here. I invited her. She can't see the invite. Let me see. Let me ask her if her asked to join. Let's just keep this going. Bear with us, people. It'll be fun, half hour. If not, I can just go over a few things. If we can't get this going, hey!
Okay, well, I was trying to join from my computer, but I couldn't find the invite anywhere, so I'll have to just do it from my phone. I'm sorry.
Yeah, you can't do
okay.
lives from your computer.
Okay.
Should have told you that. See, this is totally unrehearsed. Hello.
Well, I'm here. Good. I grabbed my phone because I was just kind of going to probably sit and wait there forever. So.
Oh, well, I'm glad you're here. I was afraid that your account was set to private and that we were not going to have this conversation, and I was just going to have to bore people with what I'm doing. And like with all the different gadgets and whatnot. So thank you, first of all, for scheduling this. I know you have a lot going on. We see in your stories that you have the kids and you've got a life. So to schedule this is definitely appreciated. So before we get into that whole mother, wife, employee, how do you juggle that with TN? Let's kind of start at the beginning. When you first started to notice symptoms and you knew something was wrong.
So looking back now, there may have been some signs, like earlier on, but nothing extreme. I was living my life. I'm healthy. I exercise. I eat well. On December 15th of 2021, I went in to get a very, very small filling on my bottom right back molar. And shortly after that, I was having like just pain, discomfort. It was bothering me more than what I thought it should be. So on December 18th, I went and I got my immunization, my COVID booster shot. I got quite sick when I got that shot. Like my lymph nodes under my arms were like golf balls. It was right
Oh
in and
boy.
around that time. And I'm just want to preface this. I'm not anti-vaccine. I'm fully vaccinated. I'm simply stating the timeline of events. Saying it's,
Of
I'm not going one way
course.
or the other with that because I don't want to even get into that conversation. But anyways, the pain was increasing. So, I'm in like a lot of pain and I'm going back to the dentist. I'm getting x-rays done. They're doing scans. They're telling me anything wrong. So family the end of December. And so we went away. And about a week into my trip, the pain was so excruciating that I went and just found an endodontist in Florida. I'm Canadian. And I went in and he's like, well, let's do a root canal. There must be something wrong with your tooth. So that it's a very long, complex story. So to avoid kind of going into all of the details, basically then from December 15th until May 10th, I ended up having 3 root canals, both my bottom back right teeth pulled, and then oral surgeries, debridements. So they went in and they dug it out and everything, all chasing this, pain that was in the bottom right here that was just excruciating. I mean, something I had never experienced before. So yeah, there was a lot of, pain and suffering that was happening in between those invasive treatments that I was getting done. And I wasn't going back to just one dentist because these were like emergency situations where I was literally just calling anyone that was open and I was going in, please
Yeah.
do something, like take my tooth out, do a root canal. I was a willing participant in all of it because I just wanted the pain to end. And with each one of those procedures, I would get a little bit of relief for days, and then the pain would
Mhm.
come back tenfold. So
Were they putting you on prednisone and a prednisone oral
no, I
mouthwash at
wasn't
the time?
on. Actually, no. So I was put on a short round of dexamethasone. So another on that.
Okay.
Also, between
Yeah.
December and May, I had been put on 7 rounds of antibiotics because they kept me infected. Let's
Mhm.
do some more antibiotics. So, I'm getting sicker and sicker as time is going on. And then it was after my last surgery in May that I realized, okay, something is really, really wrong, and it's probably not tooth related.
And none of the dentists, the endodontists, none of them
One
suggested
instance
TN.
where I went in and the dentist, was examining me and he said, this could be trigeminal neuralgia. And then, but then immediately he said, but that's too rare. He said, like, chances are that's not what, that's too rare. So no, nobody really,
Mm.
really knew what was going on.
Yeah, rare happened to me.
Yeah,
So rare does happen. And uh, not to get into my story, but like I just had something done on my tooth and I had to take medication. They had to give me nitrous oxide. I was a nervous wreck. I still am, because I know, and they downplay it like it's rare. I'm like, yes, but when something rare happens to you and you know that what you're doing could potentially lead to something, uh, on my good side, of course
exactly.
I'm going to be nervous.
Somebody
So
facing
um
pain just asked,
yeah,
looking
so
back now, did those procedures trigger your TN? So that's a really good question. I've done a lot of, obviously, like looking back, trying to figure out like what went wrong. So I guess the short answer to that is I personally don't think that those procedures caused my TN, but I can't know
right.
for a fact that it exactly, completely. I actually have nerve damage now in this whole part of my jaw. Like when I touch it, it feels like pins and needles. And so yeah,
Mm-hmm.
I do think it was the last surgery that I had in May where they damaged the nerve on top of it. I don't think it caused, I don't think all of that caused it, but because, and the other reason is that originally everything was here, and then over the course of a few months, actually I shouldn't even say a few months, a couple of weeks after my surgery in May, I started to develop pain in this area, and then in this area, and then so this is where all the
Yeah.
dental stuff was done. And then in June, so we're talking like maybe a month and a half later, I started to get a toothache on this back molar. And I went in, and he's
Oh
looking at my
no.
x-rays, and he said, don't touch that tooth. I can't really see anything wrong with it. And sure enough, within about 2 weeks after, I started to develop the neuropathic pain in the jaw and in here and up here. So I've now developed it. I have it bilaterally. Um, So yeah, it's hard to believe that the dental is the cause, because how do you explain, right, like the left side? Because I didn't know that. So,
Right. I feel like I agree with you. You most likely, I had TN and they pulled your teeth, and unfortunately, you lost two teeth when those two teeth weren't the cause of the TN. So unfortunately, you had to go through all of that, and now to have it bilaterally, I think that's everyone's worst nightmare. And when it comes to this, condition, disease, whatever you want to refer to it as, and I just, you have, so you have neuropathy also. So you have the electrocution, like TN1 and TN2. So you have the every once in a while you'll get electrocuted, you'll have all those things, but then on top of it, you have consistent pain, like
yeah,
I do, where I have
yeah.
the
So everything
constant.
started off atypical pain, both right and left. Um, and for the longest time, I would say to myself, well, at least you're not one of those people who has both. And just over a month ago, I was at the gym because I used to work out like 4 or 5 days a week. And then that, obviously, when TN entered my life, that all came to a stop. But yeah, about a month and a half ago, I was at the gym and I was just putting a weight down, and I felt just this bolt of electricity across.
Yeah.
So now I have, yeah, the atypical, up till now, I've only had off on the left side. So I've had that happen a few times. It hasn't been, I mean, it hasn't been often. It's been about maybe 4 or 5 times. Um, so yeah, I don't know. Does that mean things are progressing? Um, it's hard because you go into the your doctors, and they're telling you that, like, well, what you have is statistically impossible, right? Like you can't have it bilaterally in all three branches. So very difficult to get across to the medical people that, like, well, here I am, like I don't have anything to gain by
Yeah.
lying about this, right? And then facing
Yeah.
pain asked, with having both wind triggers, is it both sides at the same time or one side at a time? Yeah, I would say 95% of the time it's one side. So I don't often have pain like happening at the same time. It's usually, this is my worst side, so this is kind of always got something going on. And then every now and again, like I will get the pain kind of on this side as well. But yeah, it's not often that it's both.
I mean, I commend you. I've I've gotten in the habit of
Mm.
becoming a recluse um, because of this, and you know, because I don't have children, I don't have a spouse, I don't have a significant other. I don't my you know, obviously I have friends and family, so I get out to see my family as much as possible because my parents are getting older, but my friends are all scattered, you know, and they've got their own lives. So I commend you for still going to the gym,
Let
and
me
you know, I'm
let me go
sure.
back here because I don't want to. Here, I'll just answer these questions because I don't want to. Does
Yeah.
medication manage the pain at all? Yes, I am on medication. I'm on Lyrica and amitriptyline, and I do believe it helps with the atypical pain. It's really difficult for me to say if it helps with the type 1 pain because I never experienced shocks prior to being medicated. So I don't really have anything to compare it to. But from what I have felt when it's happened, I'm like, it could probably be managed a little bit better. So anyways, I'm seeing the neurologist on Tuesday, so we'll chat about all of that. And then I Sally, I also have bilateral. Do you find one side is more painful than the other? Yeah, my right is the worst. So the side that I had all the dental trauma on is the worst. Um, Back to what you were saying, I don't
Yeah.
want to give people the impression um, I've just been rocking this and like I'm looking after kids and all.
Yeah.
So let me be completely honest. From the months of May to about July, I was bedridden. I lost 30 pounds. I stopped eating. Um, I I stopped getting out of bed. I and then eventually my kids. So when my husband worked, so when he would be working, my mom and my dad would watch my kids for me, and I would just be like completely incapacitated in bed due to the pain. And then my in-laws would also take my babies when he would be working. So like you know, and I've only been going back to the gym in probably the last 3 months, maybe, and just slowly. So no, it completely ruined. Well, I shouldn't say ruined my life, but like, it completely incapacitated. And I want to be honest because
Right.
I don't, like I said, I don't want people to look at what I'm doing and think, you know, oh, this she's living at a 10 out of 10 pain level and she's doing all. What's wrong with me?
Yeah.
Because that is
Yeah.
not the case. My right now,
Yeah.
I get flares very often, but they are for the most part manageable. I do them at home. I do believe the medication is helping. So I'm not at a 9 or a 10 out of 10, and like, you know what I mean. So I just don't want.
Yes. Yeah. I was going to ask you about your medications and what you were taking. So you take
And
Lyrica and
the
amitriptyline, and
Lyrica
that's
was it's rough. For probably the first, I would say, 8 weeks that I started it, I it was absolute hell. Like I almost threw in the towel multiple times. I was on and to be
oh,
on, you know, all of a sudden anticonvulsant, you know, a moderate pain was so severe that things, you know.
I'm
Can you hear
losing
me
you in and out
okay?
with the audio. Oh, okay. I can hear you a little better. I think it was a
Can you hear me?
connectivity
Okay.
issue. Okay.
Yeah, so I
Yes.
was going up on my dose quite quickly, and so I'm on 300 milligrams a day, which is the highest you can go is 600. So I'm not like a low dose, but I'm kind of middle area. But yeah, it took about 8 weeks for me to be able to actually function as a human being. Like the depression, I've struggled with my most of my life, and so I was just saying to somebody else the other day, I said, you know, uh, I've struggled with my, and so it has just exacerbated that. But I said it'd be hard for me to believe that someone who's mental health issues wouldn't have some now if you develop. trigeminal neuralgia, right?
Yeah. Yeah. I have a, a team of, uh, of mental health professionals. I too have struggled with mental health issues my entire life, and this just threw me. I'm sure, like everyone else, I'm assuming. I know we're getting a little off topic. We're going to get back on it, but this is just the way the conversation's going. So I'm sure that I know that with myself, I still, even after all these years, I look back and I cry about what I could have done when I was healthy, or what I missed out on when I said no to a party and I should have gone, or I didn't, all of these things that I didn't do, and I'm still in the process of like mourning that
Yeah.
old life. Um, I have books that I read. The one that it's okay that you're. I actually have it here. I always suggest this book to anyone. It's okay that you're not okay by Megan Devine. She goes into grief as the psychiatrist who was counseling people on grief, and realized that she was doing it all wrong when she actually watched her significant other of 18 years drown in front of her. So she realized that she was counseling people that were dealing with grief all wrong. So I don't know if
I
that's
would
something that you deal
say
with
every
as
day.
well.
Probably not a
Yeah.
single day that's gone by since December of 2021 where I don't um, miss what was, and that I
Right.
took my health for granted, you know. And I, when you think that I'm not in my 20s, I'm almost 40, but I'm still fairly young, and would look at myself from a physical
Yeah.
standpoint as far as the exercise. So, it's still difficult for me to kind of come to terms with the fact that this has been what I've been dealt, I guess. And
Yeah.
yeah,
Yeah.
I didn't realize actually for months that when I would be, just an absolute mess and bawling my eyes out, that what I was experiencing was actually grief for myself. I've
Yeah.
lost people very close to me, so I know what grief feels like, but I guess I never realized that you could grieve you, right? Who you used to be and
Yes.
the life that you had envisioned you were um, yeah. And someone just asked, does
Yeah.
Lyrica have side effects? Oh yeah, it does. It's one that I deal with
Yeah.
right now. Well, when I started, I would say depression. It definitely can make you quite depressed. That's not an uncommon thing. But now I would say the cognition aspect. So very difficult time remembering things. I forget to pick my daughter up from preschool often. Just, you know, the cognitive, I guess, effects of it. So
Yeah, I'm on Lyrica. I'm on the max amount, and I don't know if I notice a change with my depression. I did know, and I don't know if it was the baclofen as well, that I was like, because have to take both of those in the
yeah,
morning. I was like a zombie. I was so exhausted, and I was like, some my doctors are like, some of them are like, how are you functioning? I'm like, I have no idea. So they put me on some other things to offset the drowsiness, to so that I could function during the day.
snowball
And try
of like,
to.
well, you go from nothing to one med to two meds. Now they want to add a third one or a fourth one. Like it's yeah.
Yeah, I'm surprised you're only on two, because I'm on Lyrica, baclofen, amitriptyline, lamotrigine. Um, And then when it's severe, because I have anesthesia dolorosa, I am on Norco, which is an opioid. I do take that when necessary, but that is when I can feel the pain going into my bone. So I am profanol, I forget. But yeah, I just take whatever, because I just pray that the whole combination of whatever is
Yeah, of course.
doing
I mean, we're
something.
not really, sorry, someone just asked, how do you manage when you're really struggling to eat? Well, I only can use the left side of my mouth. I've not used this side of my mouth since December of 2021. I do get shocks in one of my teeth often. So chewing, how do I manage with chewing? It depends on the day, really. Some days I'm able to eat kind of whatever I want. I don't really eat anything that's kind of hard or, really difficult anymore anyways. Um, but some days I'm able to eat with little to no pain, and then there's other days where I'm just water and a spoon. So I mean, anybody who has this knows the unpredictability that comes with it, so it's even know what
Yeah.
each day to day is going to look like.
Yeah. Same here. I haven't chewed on the left side of my mouth since June 12th of 2017. And then the right side, I have limited to soft foods like applesauce, oatmeal. I try to eat very soft mashed potatoes, because I, I don't want to damage any of my good teeth, and the good side. So that's why I'm also fearful of
I have
that
uh, I
happening
have
as
two teeth
well.
on this side that need dental work done to them. I have a filling that needs to be replaced, and I have a crack in my back molar, and I can't even bring myself to book a dentist appointment. I used to go every 6 months to get my cleanings done. Like really good care of my teeth. I still try to take good care of my teeth, but I I can't even bring myself to, book the appointment because like you said, when you only have one side of your mouth that you can chew on, the thought of something might happen to this side and then you're
Yeah.
what a mushy diet for the rest of your life, right?
Yeah, where you can't enjoy food. I mean, I was just going to I was just thinking of something that I wanted to ask you. So I know that we were going to talk about this, but just because we're on the teeth side, did you switch to like a Sensodyne
I
toothpaste
do, yeah. I've
or
been using
whatnot?
Sensodyne for years because I clench and so my teeth are quite in the back, quite worked through. Yeah, so I use a Sensodyne toothpaste. I will often just like rub the toothpaste along my teeth and just leave it there, just kind of let it.
Hmm.
I have this other stuff. It's called Me Paste that you can order off Amazon, and it's a calcium phosphorus paste, and it's supposed to actually help rebuild enamel. Or I use that.
Yes,
So
yes, yes. Hmm. I've tried the syringes of the remineralization. Facing Pain says to try a kid's toothbrush, which is a good idea when flaring. And then I also found, and I just have everything here with me so I wouldn't forget. I never knew this existed, but because I was so afraid, I found Listerine. Um, sensitivity, and with continued use it's supposed to help you from painful tooth sensitivity. And so I've been using this like constantly, and I've only been able to find it on Amazon. But just not really, not remembering that you had that this started with your teeth. um and not by from a dentist, but possibly the dentist, the dental work made it worse. So with all of this going on, where, like, how, I mean, you got into a little bit about your family members helping out. You were in bed for a month. That's gonna happen again. You're only human. You have this horrific condition that affects both sides. And, just like I, I go through my ups and downs where I'm like, hell yeah, I've got this, to I can't get out of bed. I can't move. The pain's so bad. You don't want to die,
Yeah,
but
yeah.
you want to die.
I can definitely relate to that. I have a beautiful life, and I have no reason to want not to be here. But during those like the worst periods, I definitely wanted to die. And it's not that I wanted to die. I just could not fathom living like I wasn't. I couldn't live. I wasn't living. So um, yeah, there's some pretty heavy emotions and feelings that come up when this is something that kind of takes over your whole life.
How do you define living now for you, Courtney, versus the old Courtney? What's like a good day in your life, like where you feel like, okay, today's a great day. I feel like I've lived, I've experienced joy, happiness. Maybe I smiled.
Yes, I would say that this has definitely changed what I consider to be a good day. Um, After a few months of not being able to look after my kids, a good day now for me is a day where my pain is manageable enough that it doesn't interfere with my ability to be present with my kids. You know? And the
Mm-hmm.
days where I I don't wake up in pain, those are good days. But the pain eventually comes, but like when I wake up in the morning,
Yes.
that's a good day because it's very difficult to have a good day when you wake up and the first thing you're experiencing is pain. So it's hard
Right.
to mentally kind of say, well, like today's going to be a good day from the minute you wake up in the morning. So that's how I adapt to it. Like if I wake up and I'm okay, um, even if it comes on like a little bit later or a couple hours later, at least I didn't wake up in that condition. And so, but yeah, I definitely appreciate. I mean, it's hard to say that anything good comes from this. Um, but the reality is, I definitely appreciate just being with my children, um, and laughing and smiling because there was a few months where I did not smile, and I said to my husband, I said I don't know that I'll ever smile ever again. Um, yeah, so
Yeah.
every day that I'm able to find the joy, in the certain moments and experiences, is a good day. Like last week, I think it was, I was able to volunteer at my 9-year-old's on her field trip. And that's something that
Oh,
I never thought that I'd ever be able to do again. And like those little things bring me so much joy. Being able to just
of
kind of
course.
do things with my kids.
I would assume,
That's
though,
the
it's
other
hard to
thing, right? Is
plan.
because I have anxiety, I'm a planner and I like to know what's happening. I like to know all the details. And this is so unpredictable that you really plan
Yeah.
one day to the next. Um, you kind of just really, truly, truly have to go one day at a time, hour by
Yeah.
hour, right? It's that's how quickly things can change. Like yesterday, it started off as a really good day. I went to the gym with my 14-year-old. We did some exercise, and I was just really happy to be there. And then, I got home, and within about a half an hour, I started to have a flare, and I was then, on the couch and, sobbing a bit, and the two younger ones are seeing that. And so anyways, I don't want to get all, I don't want this to be like a really bad negative conversation, because it can really get to that when, but my
Yeah.
point is that's how quickly it can change, right? Like you can plan
Right.
anything. I had a friend ask if I wanted to go to an event at the end of April, and old Courtney would have been able to say, yeah, sure, like I'd love to go, but I had to say, I can't answer that. It's really hard for me to be able to plan 3 weeks from now, and I don't want to plan things with people and then bail on them the day of. And that's the reality. Is you just
Right.
it's it's very difficult to plan anything with family, friends. You just never, like.
Yeah. Yeah, I was actually, even with planning this live, I was like, gosh, I hope I'm okay. And then I'm like, I hope Courtney's okay and that she's, well enough to partake. And not getting into like a depressing side of everything, but I'm assuming your children and, your husband obviously knows, your children know you have this,
No,
and do they
not really. I
understand?
mean, I have four daughters, for those that don't know. They're 14, 9, and 20 months. So 14 knows and, understands her. The reality is that regardless of how much our family or friends love us, they're never truly going to understand what this actually is. Um, the 9-year-old, she doesn't like. She'll ask me, "Mom, when is your face thing gonna go away? Is it gonna not be like this anymore?" So she doesn't understand, the context around it. And of course, the 3-year-old and the 20-month-old, like they have no idea. So I mean, I
Right.
feel like my friends and my family, that love me very much, and I doubt, how much they love me. But what's difficult is that it's a very isolating, it's a thing to have. I can be in a room full of my family and feel completely alone because nobody knows that,
Yeah.
that I'm in pain at the moment. They can't understand that, and so I feel like one of the things you do have to do to maintain your own sanity is lower of what you think the people around you are going to understand. They just can't.
Yeah. I actually have, let me grab it real quick. I think I have some here. If I don't, dang it. Don't know if I do. Oh, yeah. So, I have my website and I actually added you to it and I added some pieces of, so what I do is I keep little cards in my wallet, and then it says, it's a little brief description about what TN is, and it's like to find out more about my condition so that, hopefully people get a better sense of what it is and what we go through, and they can't see that we're what our face is feeling like, whether it's a vice grip or if it's being stabbed or the pins and needles or the electrocution or whatnot. Oh, is your
In
face
this
numb as
area, I
well?
do have, like the pins and needles, feeling. No,
Okay.
otherwise I don't have any numbness.
Okay, so you can feel.
In
Okay,
this area
good. Good.
where they
Yeah.
did all
I
the stuff down there, they did something to my nerve down in the jaw area, but the rest of my face, I'm not numb.
And so, does your dentist, now that that your regular dentist is aware of your condition? So they understand why
And
you would be
they
hesitant to come
actually,
in for.
because I've been having some issues on this side with a couple of my teeth, he actually doesn't even want to touch me without me seeing an endodontist first and getting some scans done to make sure that, like, because he doesn't want to start going in and drilling anything without knowing that there's, like, for sure something structurally wrong with the tooth. So yeah, he
Yeah.
understands, but despite how understanding he is, it doesn't remove the fear of actually going in and having anything done. So
And then you see your neurologist
third
this
neurologist
week.
actually. So yeah, the first neurologist that I saw, my very first appointment, he told me when I said I'm also like experiencing pain on this side, he told me, he said, I'm not worried about your left side. He said, there's no, you can't have it bilaterally. He said, it's too rare. So right away, he just, like, from the very first appointment, just completely shut me down. And then very quickly, when I was going back for repeat appointments, he said, I don't know what to do with you. Because I started to get stabbing pain in my tongue and in my throat, which is cranial nerve.
Oh, it's horrible.
So that's typically the glossopharyngeal.
Yeah, that's a
Yeah.
different nerve.
And so
That's
I
a
do
different cranial
experience that
nerve.
as well. And as soon as I told him that, he said, I don't know what to do with you. He referred me on to someone else. So I'm on my third neurologist. I've only seen him once. He kind of was stuck on the fact that this might be migraines. And I was like, these aren't migraines. But he wanted me to try this nasal spray. And what I've realized is for a lot of doctors and specialists in this field, anyways, because that's all I can speak to, is that you kind of almost have to, like, just agree to try what they want you to try before you can move on and be like, okay, can we, like, veer into the right direction now? Okay, I've tried the nasal spray. It obviously did not do anything for me because I'm not having migraines. So when I go back and see him on Tuesday, then at that point, we'll discuss a little bit more.
So this is
Yeah.
a new neurologist. So have you ever had an MRI? Because I'm concerned about the gloss, that nerve being affected,
Yeah.
because
Okay,
that's a
so
different
I've had
nerve.
2 brain MRIs. Both of them were reported by the radiologist as being completely normal. They couldn't see anything structurally wrong on either MRI. And I had them done with and without contrast, and I had them done with the cranial nerve protocol. I think in the United States, it's called a Fiesta MRI. Called, it's not called that here
Yes.
from my understanding, but I did have considered one. So anyways, they were reported as being completely normal, no structural cause. And then I met a woman who's an American, and she kind of pointed me in the direction of a neurosurgeon in in California. So I had a virtual consult with him, and then he told me that he found a compression of both my left trigeminal nerve as well as my glossopharyngeal nerve. So I went from 0 compression to three compressions. So totally.
So what do you, oh, if that's true, then you could
So
have
this is the
MBD.
thing. When I went to the new neurologist that I have now, and I told him about the American neurosurgeon that I saw and what he had said, I gave him the report in writing, and he basically said that he didn't believe this doctor because I am Canadian. So he said, they see you coming down there and they see dollar signs. So, okay,
Oh
well,
my
in that
gosh.
case, I said, I would like you to please refer me to a neurosurgeon here, because up to that point, no neurosurgeon had actually ever reviewed my MRI from where I am. And so that's what I asked for. So I'm on a 6 month to a year plus wait. to see a neurosurgeon here. And the thing is that that's going to be the end of the road for me here. If this neurosurgeon comes back and says that he doesn't see anything, I will not be able to see another neurosurgeon in my province because it's all based on referral. And no, they will not refer me to another neurosurgeon when one has already seen me and has given their opinion. Our system is very different here as far as trying to see specialists. So I was offered bilateral MVD surgery by this American surgeon to the two.
Do you mind mentioning who it is,
his
or do
name's
you not
Dr.
want to
Lim.
mention? Okay, he's
doctor,
well
but
known,
anyways,
yeah.
so it was to the tune of over $300,000 American cash. I don't, I would have to pay that out of my pocket. So I don't have that kind of money. So if this neurosurgeon comes back and, like I said, says that he doesn't see anything, then I'm not really sure what I'm going to do with that.
Did Dr. Lim charge you for the consultation?
He didn't, and I'm not
sure
if that's because I'm an international patient, because they have an international program. So I don't know if it's because he knew I was Canadian and I don't have insurance, that he did it for no cost. So I can't say whether he charges if you are.
Okay, because I mean, I do have somebody that I'd like to connect you with that would also probably would love to probably review your scans and to see what the hell is going on, because if that is the case and you can be helped with MVD, because like I said, the gloss, that nerve being involved is very bizarre to me, and I'm not a neurosurgeon, but because I've had a brain tumor, I have another brain tumor, and I've researched cranial nerves, so I kind of have an idea, and I'm like, this just doesn't sound right.
I go from being a healthy, young, active person to all of a sudden I have these 3 cranial compressions. I don't know. I still, every single day, I'm not even exaggerating, every day I try to go back to figure out what has happened. I've been told by some people that, you need to just accept it and move on. But for me, and that works for a lot of people, because a lot of people do move forward, completely understand. That's very difficult for me to do, and I have yet to be able to do. Somebody commented, that's an insane weight. Welcome to healthcare in Canada. So that's not I'm also on a referral as well, and told it.
I'm losing you again. I don't know if it's the connection.
Yeah.
Okay. Let me see if I can hear you.
Can you hear me?
It's a little muffled, but you were going in and out like it was a connectivity issue. But let's see if we're good now. No. No, I just heard like a gentle.
What if I hold the phone? No? Yeah?
My
face is really close to the camera. Okay.
Yeah, but you're gorgeous, so it's fine.
I was just saying, I don't know where I cut out. I was just saying that the wait times that I'm describing is not uncommon at all for the way things are here. And then somebody said, go to Dr. Sekar at Harborview Medical Center if you can get a referral. I don't know if that doctor is Canadian. I'm not sure. So I'm not sure. I don't know that name, but yeah, if you can let me know, Emily, if that's a Canadian physician.
So if we have to, we'll just have to set up a
I,
GoFundMe for
you know,
Courtney on
someone else has
rehearsed.
mentioned that, and I would find it very, very difficult to do that.
I I understand not wanting to do that, but if that is your only choice and that you can find some relief, um, because it's I believe and trust Dr. Lim's assessment of so he had a radiologist at his facility look at your scans to write a
He
report, or
looked
did
at
he
them,
look at
to
the
my understanding.
scans?
He's the one that looked at them.
Okay.
It's just, you know, so bizarre. Like I said, how I went from two doctors here saying that they saw nothing to him saying he saw three. So anyways, where I'm at right now is I'm just waiting for this referral. I'm going to go in with just an open mind and an open heart. I'm not going to try to go in with any expectations as hard as that is, because you know, I've wanted a neurosurgeon here to review it, because to me they are the experts at reviewing brain imaging, right? Like radiologists are
Right.
amazing, but they're kind of like GPs in the sense that they're like a jack of all trades. They're looking at multiple different scans and have, you know, all the time, whereas a neurosurgeon is specialized in reviewing brains specifically. So I've heard, from what I've heard so far, I would say 95% of what I've heard about the doctor that I'm going to go see has been positive. So um, I'm just going
I hope you
to.
have some questions written out, and you know, I've learned to audio record um, my sessions with my doctors to make sure that we are all on the same page. Um, but I you know, I really just commend you for getting out of bed each day when you can. And how are you? Do you work full time or
No,
is it
so
part time?
I'm a casual employee. So I don't hold an actual position. I'm a respiratory therapist. That's what my career is. And yeah, so I'm casual, which in a sense last year was good, because I was unable to work from April until probably October. I was completely off work. But the other thing about my job is if I don't work, I don't get paid. So
Yeah.
there are some limitations that I do have now in regards to some of the requirements of my job. Hoping will
Yeah.
improve, but it has impacted. Without divulging too much about that part of things, it has impacted my ability to work in the capacity that I would like to be working. Yeah.
Yeah. Yeah. I understand. Many in the community are on permanent medical disability or you know, work from home jobs um, to when they can and they have the energy to
But one of the
work.
things about my job is
Um,
that I'm required to wear a mask the entire time that I'm working. And, you know, when I'm having a decent day, it's not really an issue. But on days where my face is particularly
yeah.
annoyed with me, it wearing and having a mask on,
Oh
constantly
no.
rubbing against my face is not always the most pleasant pleasant way to go about my day.
Do you get an exemption for that,
No,
or they won't give
no. And
you?
type of work that I
Oh
do,
my goodness.
I'm working with patients who are, a lot of them have contagious respiratory illness. Why, like I do
Yeah.
have to protect myself. So yeah, it's just part of the, no, it's part of my job. Hmm.
Yeah. So with I think we've gone over a lot is there anything, I know that you have asked me about some things that I've been doing, so I just wanted to go over them with you so that everyone else can kind of get an idea as to what I'm doing. But is there anything else that you wanted to add regarding your condition and how you, you know, I feel like you have to be gentle with yourself, especially as a mom and a wife, and realize that things have changed, and maybe you can't do it all, and maybe other days you can, but I think you especially need to be gentle and not hard on yourself. And but that is just me talking to you as another human being, because I can't imagine what it's like to have a family and have TN. So I know that it's hard enough on people who have it without having a husband or kids. So I'm sure it's even more so for, moms and dads, and feeling, like they can't give 100% all the time.
I don't want to get emotional. No.
I'm sorry. I just don't want you to be hard. That's the point. I want you and everyone else in the community just to be easy on yourself and gentle on yourself, and not.
I can't say that I have the answer to moms out there, dads out there that are dealing with this. There is something particularly cruel about being handed this when you are a young parent with young children who you have to look after. I would say it's very, very, very difficult on a lot of days, but on some days, my kids are what keep me going. I have to look after them. They kind of keep me going when I want to throw in the towel and just kind of give up on everything. One of the biggest things that I've had to learn is to be careful about what I expose myself to on social media or online. I'm very bad for comparing myself to other people, and so I'll look at other people, like my peers that are my age, and I see them doing these amazing things with their lives. They're furthering themselves in school, they're taking on jobs and promotions, they're going on these trips and these adventures, and I'm sitting there thinking to myself, like, what has happened to my life, and I feel like I'm barely getting by some days. But I guess, just like you said, the kindness aspect, if a friend came to you in this situation, how would you approach that? And you kind of have to remind yourself that you've been dealt something that a very small number of the population can relate to. So you do have to just take it one day at a time. And I would say one of the good things is that I have found a community of people who do understand and who do get it. And I think for anybody out there who has just been diagnosed or thinks they might have it, if you can just find one person in the community that you can reach out to on those days, where no one else around you gets it or understands, I think that that's really important, because it can be very isolating.
Oh gosh, yeah, it's definitely isolating and facing pain. Courtney, you are amazing. Please know that you have a community always ready to listen or just talk. And I think that goes for everyone in the community, that there's always somebody you can reach out to. And sometimes not saying anything, and just letting someone talk to you through the pain, whatever you need, people that have it get it. And it's a heavy diagnosis to accept, and I feel the same way when I look at some social media of my friends and they're out and they're having fun. And I look at my old life and my clothes and my shoes and everything that everything's changed for me likewise. So it's, and I applaud those who accept it and can move on. I have not. I don't know if I ever will. I'm trying to step out of my box a little bit more. And, it's baby steps.
For me, sorry, I didn't mean to cut you off. I just, on
oh,
that,
no,
on that
it's
note
okay.
about the acceptance part, for me to think that I will have this every day for the rest of my life, and I might have another 40 years on this earth, to think that that I might have this every day for another 40, for me, is too difficult to accept. I still believe that I'm going to not have this one day. And I know that might seem very foolish in the face of all of the scientific evidence and the doctors that will tell you this is for life, it's just going to get worse. Like, what keeps me going every day is believing that one of these days, I'm not going to have this anymore. And that's really foolish, but that's what keeps me going. Hope, exactly.
Hope.
A very condition to have. If you go, any online reading or researching that you want to do is so doom and gloom. When you read about our condition, there's nothing positive at all with the prognosis or any of that. So if you buy into that, that's a pretty depressing thought to have, that this is every day and it's just going to get worse. And you're telling me that not only am I going to have this every day, but it's going to get worse.
Yeah, it's hard it's the rabbit hole, and I try to avoid it. When my mind starts thinking about the future, I'm like, I'm like, I can't do this. I've got to stay focused. I can't think about like 5 years, 10 years, because I will just go into I'll start spiraling downward. So I just try to bring myself back to, okay, I can't worry about tomorrow. I can't worry about 10 years from now. Like, I just need to do now and hope and pray for a cure, for some better treatments, for some more money to be put towards research, so, and I'm constantly researching like new treatments that might not be in the mainstream. And like we've talked about, and I'll briefly go over, I already talked about the Listerine, the tooth sensitivity. I think that's great for anyone who has the TN and you especially feel it in your teeth, which is the worst. I just found a report, I think done by the NIH, with pulse electromagnetic field. So I bought a mask, which I put on my face. And I do this several times a day. I have these are intranasal. So I have two different, one is, they're both red lights, but one's infrared and the other one's near infrared. And they literally, it's so funny when I wear them because they literally go up your nose and you turn it on. And then the other one, because they're this one goes, so I'm online. Hi. And so I'm like, and then I try to multitask. And so then I'll take this and like use a headband and wrap it around and then turn this thing on. So I am like from every angle hitting it. I'm like, all right. So these are all in my like toolbox, but these I got through a company called V-Light, and why I bought them, because right behind the nasal cavity is a lot of where
Yep.
all of the cranial nerves. So I felt like this, when you research infrared and red light therapy, they do suggest it for
Mhm.
TN. But I'm just noting that I'm not a doctor. I'm just sharing the crazy crap that I do. So if you want to try it, and then I have this Bauer, it lights up. It's another red light that I just shine on the side of my face, my TN side, which it would be this side. Love this. Had this for years. I started on the
Yeah.
EMLA cream that we discussed. The EMLA cream with the Zostrix. I feel like it has definitely dulled. So I do feel like it is working, but I found out later that you're supposed to put saran wrap over
Yeah.
it after you apply it, so that it absorbs more. And then I just started on the NAD Plus and then the B12 injections. And then I'm also seeing if I can get the NAD Plus nasal spray, because I found research that those, especially the NAD Plus, is supposed to help with nerve regeneration and inflammation. So I've got a lot of little things in my toolbox that it's a full-time job.
I've been injecting myself with B12 and B1 as well. And yeah, so I've been doing that for a few months. I do think it does help a little bit. This is, of course, anecdotal. I don't have any literature to share with you. I'm just from what I tend to notice. I also take various types of CBD oil religiously 3 times a day to keep it at a steady kind of state within my system, because you do need to take it regularly if you're going to get any benefit from it. So if I'm having a flare, I'll take a really high dose of CBD. I'll inject myself, which is crazy. Like, you know, the things that you start doing, you know, that you really never saw yourself at one point doing, when you're desperate to get relief, you know, you're kind of willing to try everything. I'm on so many different supplements. My husband says that I probably have like the most expensive urine. Because he thinks I'm probably just peeing them all out. And he might be right, but like, I'm still going to buy them and I'm still going to take them, you know? So, yeah.
Yeah. Somebody asked me the other day, are they working? And I said, my answer was, I honestly don't know, but if I wasn't doing all of
Yeah,
these different
exactly.
things, would I be worse? So I'm going to keep doing it, assuming that it's helping me, and that if I stopped, I would get worse. And so, you know, a lot of these things are pricey. I'm fortunate enough that my insurance covers most of it through the FSA account. But yeah, so that's my little regimen along with all my medications. But like, I just want to preface to anyone that, you know, is watching this, that Courtney and I are both not doctors. If you want to try anything we've mentioned, please consult with your physician. And, you know, I really appreciate your time, and thank you for joining and not being rehearsed. And this was because life is not a rehearsal or whatever. There's some phrase about dress. I forget what it is, but anyway, so thank you so much. I hope we've helped people, and I feel blessed to have met you, unfortunately, through this community. But I'm grateful for you and for your time, and I hope you find some relief. And I'm going to contact you offline about
Sure, that would be
somebody I
great.
think you
And I
should be in
just want to
touch
say
with.
that if there's anybody listening that, you know, wants or needs somebody to chat with, I'm always open to getting messages and, you know, talking to people. I feel like there is some purpose in some of this. And there have been people like yourself and a few other people that have really, really been there for me through this and have helped me through. And I want to repay that to other people. Like you said, like I would never want anyone to be in this community because of what we all have. But if that's what you've been kind of dealt, then yeah, there's lots of us that are more than willing to make those friendships. You know, I've made a lot of friends that people that I can call friends now, like perfect strangers on the internet, you know, that get it. They actually get it. They get it.
Yeah. Yeah. And it it fills your heart when you're able to help somebody out. What, you know, when they're having a difficult time or trying to understand their condition, and even if it's just a, you know, a quick hello, how you doing? Are you okay today? It's really rewarding to be able to help people in the community, and I'm so grateful that you you know, do that and are willing to
it's an
help
invisible
others
illness.
in the community.
So, you know, you learn that quite quickly, that because you're not in a wheelchair, on crutches, you don't have a cast, people look at you and think, oh, you put some makeup on, like everything must be fine. It must be all gone. You must be all better. But I mean, it's invisible, right? And we're often dealing with it every day. We just don't talk about it all day, every day. Because can you imagine if we talked about it all day, every day? Like I wouldn't want to listen to myself. So I imagine the people around me don't want to hear it constantly, you know? So.
Well, I think we've normalized things that other people would never understand. We've normalized like a pain that just anyone else would, you know, I don't even know how to explain it, but we've normalized something that should never be normalized. This pain should not be normalized. And unfortunately, after you've had it for so long, you start to normalize it and you're like, wow, I can't believe like that this is a part of my day. And I'm just like going through the motions, if you will. But I don't want to live like that. I want to smile again and feel joy and happiness and not just go through the motions.
Just finding little moments of joy in each day, you know, things that you would have taken for granted before, like going for a walk when it's not really cold. It's very cold where I live during the winter. So, you know, just little things, being able to go outside with my kids for a half an hour, just things that you used to take for granted, you learn that those are actually very special.
Yeah, absolutely. Well, I can tell you that you put a smile on my face. You've almost brought me to tears. I'm a crier, and so
right.
So thank you for putting a smile on my face, and thank you for such educational live that I hope we've helped many people out there in the community. And I hope you have a fantastic evening, and much love and blessings to your family.
Okay.
Talk soon. Bye-bye.